Now that you've learned about treatment options for carpal tunnel syndrome, it's useful to consider how different approaches impact your short-term and long-term comfort and recovery, as well as your pocketbook. Your financial calculation should factor in the cost of the procedure, as well as the importance you place on your time and care experience. For example, the time required preparing for a procedure or lost work and missed activities during the course of your recovery. Fortunately, carpal tunnel release using Ultra-Guide CTR and real-time ultrasound guidance, or CTR-US, can offer an enhanced procedural experience, minimal prep time, faster recovery, and a more straightforward payment structure than other treatment options. Preparation and recovery time for the different treatments can vary greatly. Traditional carpal tunnel surgery often requires additional time and costs for pre-surgical diagnostic exams, medical clearances such as blood work and EKGs, and testing. Additionally, you may need to wait months for a surgical procedure, all the while you continue to experience painful symptoms. After the surgery and post-op anesthesia waiting period, you could need multiple physical therapy appointments in the weeks or months that follow. However, with CTR-US, you may be able to avoid many of these uncomfortable, time-consuming, and often costly steps. Typically, no diagnostic exams, medical clearances, or additional testing are needed. That means that the procedure can usually be performed within a couple of weeks of the initial consult right in your physician's office. And recovery time for CTR-US is typically just a few days. With no post-op wait or physical therapy, CTR-US lets you quickly get back to work and the activities you love. Even when you have insurance, the average insurance deductible is over $3,100. And traditional carpal tunnel surgery often involves out-of-pocket costs for requirements like pre-op testing, procedures, and post-op care. And when you include lost wages from doctor's appointments and the longer recovery period, the true financial burden of traditional carpal tunnel surgery quickly adds up. With CTR-US, your insurance will often cover the physician's fee. And while the cost of the device is typically paid out of pocket, you can use your health savings account. And your physician may offer financing options, allowing you to spread out your payments over time. So ask yourself, is an affordable procedure with a straightforward treatment experience, minimal prep times, and a quick return to daily activities important to you? If so, you're not alone. In a recent survey of post-procedure patients who experienced traditional surgery on one wrist and CTR-US on the other, 100% said they would pay for the benefits of CTR-US over traditional surgery. So ask your doctor about carpal tunnel release using Ultra-Guide CTR and real-time ultrasound guidance, because your time is worth it.